Free Writer's Guide today.
The following segment is sponsored by QC Kinetix. Welcome back. Dr. Wade Fox is the medical director at QC Kinetix in Little Rock. He's here to explain how regenerative medicine works and how it's helping patients feel better, faster, without surgery. Doctor, great to have you here.
Yeah, thanks for having me.
When we use the term regenerative medicine, tell us a little bit about what that means specifically, because I think people may have some idea, but probably not the full story.
Well, regenerative medicine is a subspecialty, highly specialized form of medicine that's non-surgical, it's non-pharmacological, utilizing the body's natural healing processes to actually treat musculoskeletal conditions, inflammation, degeneration, pain, wear and tear. And it's all safe, virtually no downside, and again, taking advantage of the body's ability to heal itself.
Yeah, well, let's kind of drill down on what those treatments look like. I don't know if you have an example, but exactly how you are using your body to heal yourself.
Well, as I mentioned, the body has an amazing ability to heal itself, right? We've all experienced maybe a cut, a laceration, broken bone, right? And those tissues can heal. The main mechanism by which the body heals is through blood flow. Within our blood are platelets, there's healing factors. So you need blood flow to heal. And given time, the body will actually repair and heal itself. Unfortunately, there are areas in our body that don't get good blood flow, in particular tendons, ligaments, end of bones, and they tend to wear and tear and get damage over time, and those tissues tend to be more avascular, meaning they don't get good blood flow. And because of that, they don't heal very well naturally. So historically, we've used pharmacological medications and surgery to try to do the best we can to treat, but we haven't been able to take advantage of the body's healing until now. And with regenerative medicine, we actually capture and utilize the body's natural healing factors, place those those healing factors into the area that's causing the problem, and can create pain, decrease in pain, improve function, actually heal and repair damaged tissue.
So this could be a terrific alternative to a surgery or anything else, but I suspect it could also be used in conjunction with those other things too, right?
Absolutely. There's a time and a place for medications, there's a time and a place for surgeries, but oftentimes we're looking for alternatives because we're all aware there's downsides, right? There's side effects of medications. Also, often with surgery, there can be Band-Aids, it can be healing, it can be, but it doesn't, the idea isn't to heal the tissue necessarily. It's the best we've had, but utilizing this, we have virtually zero side effects, virtually zero downtime, and again, take advantage of the body's ability to heal itself.
And do you feel like more and more people are looking for alternatives now?
Of course. We're in the information age. People have the internet. They're researching. And also, because they're more educated and aware, they realize that there are more downsides to treatments than maybe they were aware of 20 years ago. So definitely there's a yearning, a looking for alternatives. And plus, we just want the best. And now that we know that the body can do better, who wouldn't want that?
I know you all have been at this a while and have a lot of success stories. Is there anything that stands out to you as maybe a good example that people can relate to?
I mean, there's just so many stories. Of course, with privacy, you want to say generalized, but just so many people that have come in, right, with just chronic pain that really impacted their life and ability to go out and function normally. And even surgery, oftentimes, right, is not telling that person they're going to improve function, but do hopefully improve their quality of life. But we've had so many people. It could be even younger. We've had athletes, right, trying to get back on the sports field. We've had people who are working in very physical labor type jobs, so all ages, all the way up to retired, but trying to stay active and be with grandkids and families. But something musculoskeletal, their shoulder, their knees, their hips, their ankles, their back, is limiting function.
Right.
And they realize the downside of medications. We've had so many people who have just come in, immediately gotten improvement and been able to avoid surgery, get off of medication, improve their quality of life. I mean, it's just a daily occurrence to hear those stories.
Right, yeah. And I think a lot of people, you're educating a lot of people in the body's power to heal. Basically, your patient base is anybody who's in pain.
That's right.
Right? Yeah.
Musculoskeletal injuries in particular.
Right, of course.
Knees, hips, ankles. It can be very helpful for inflammatory conditions, golfer's elbow, tennis elbow, plantar fasciitis, patellar tendonitis. So you can have
carpal tunnel. Is that something you look at?
Carpal tunnel is a different issue because
matter?
it's more of a compression issue on the nerve, and so it's not as much of a joint. It's obviously in the wrist joint, but not typically utilize this particular method. That's why, I mean, it's not for every condition out there, but more osteoarthritis, wear and tear, musculoskeletal pain.
Yeah, and that's why you need to call and find out how and where and when they can help you. The information up on your screen one more time, Doctor. You recommend just a basic phone call first before you walk in? And
phone is easy to get an appointment. You can also find out information on the website, and from there you get a free initial consultation. We can review your history, review your medical condition, and then make a treatment plan. And we've got a lot of different protocols that fit different conditions, but we have something for most everyone dealing with orthopedic musculoskeletal pain.
And maybe you could start feeling better that day.
That day.
Dr. Great hanging out with you.
Appreciate it.
Thank you.
Thanks.
Appreciate it. Back with more Good Morning Arkansas and more from QC Kinetix after this break. Don't go away.